Welcome you all to the Faculty Development Program organized by the School of Music Therapy. We'll start by introducing the speaker of the day. Today's speaker is Mrs. Bhuvaneswari Ramesh. She is an assistant professor at the School of Music Therapy, ISCM. She holds a master's degree in medical music therapy and is also a PhD scholar at Sri Balaji Vidyapith. Ma'am is the Vice President of NAMCAM Palliative Care Association for the Pondicherry chapter. She has authored over 8 publications and 1 book chapter. Currently, she serves as a regional liaison for the Southeast Asia in the 2020-23 Council of the World Federation of Music Therapy. She has presented her clinical work done here at SBV at the World Congress of Music Therapy in the years 2017 as well as 2014. Her current PhD research proposes to record the biomarkers of lactation and the stress factors in first-time mothers. So she is the speaker for today, and over to you, ma'am.
Thank you very much, Ms. Janita, for that introduction. Good afternoon, everyone. I'm now going to share my PPT. Okay, can you hear me?
Yes, ma'am.
Okay. All right, so my topic for this today is to talk about the different avenues and updates on music therapy research. I'm going to start by giving you how I'm planning to do the flow of the session. I want to talk about the evidence-based practice because that's one of the major things that we have to look forward to when we're doing any research or any kind of practice. But with music therapy, it actually needs more evidence because understanding music and how it works on human mind and body is very difficult has been difficult in certain aspects, and we have tried to make it easy in some parts and also try and understand other areas, which I will try and explain. Then I will be going on to what research has happened in the last 2 decades, because that would be the most recent research around the globe. Then I'll also share a bit about what kind of journals music therapy studies can be published in. The first top 10 ranked around the world where core music therapy studies are published. And then I'll be talking about what's happening in the Indian scenario. And also I will be talking a little bit more on the work we have done in School of Music Therapy, because this is the only Institute of Salutogenesis and Complementary Medicine is the only institute which has a music therapy school in all of the country. Otherwise, we have other smaller programs, but this is a place where we have a lot of space to do this. And I'll also be talking about what areas we can look forward to in which we can do research, and we can also explore our options. All right, so what is evidence? So I'm just going to go a little bit into why we are doing what research is with music therapy, because I'm sure all of you all have an idea of what research is. But then with music therapy, I think it's a little difficult sometimes. So I'm going to try and explain about evidence. Evidence-based practice is basically based on evidence. So why do we need evidence? Everybody needs some kind of data in their hands, some kind of details that will clearly explain what has happened with a particular intervention. Okay, and that is why we have to collect data, and that happens only with a certain structure of practice. For example, this definition actually gives you 3 aspects of what is evidence: indications, manifestations, and or signs that serve as sufficient grounds for beliefs. That is, we need to have some kind of an indicator. For all of us, we know numbers, we know characters, we have different kinds of information, scales, tools of instruments that can be used to create an understanding of what we are trying to prove. And based on that proof, we come to an understanding of what has happened. Apparently, the analysis of what has happened to a particular phenomenon. So why do we need evidence? Because, Okay. So Cochrane, actually, I'm sure all of you have heard of Cochrane, one of the most strongest databases where all the review articles are done. Cochrane has actually adopted a definition based on many different kinds of definitions for evidence-based practice. They have in psychology, they have in medicine, they have other areas where they've actually spoken about evidence-based practice. But Cochrane has taken all of these definitions and given one particular definition. That is, evidence-based clinical practice is an approach to decision making in which the clinician uses the best evidence available in consultation with the patient to decide upon an option. So basically, there are three parts that we are looking at. One is it's a clinical practice. Next is we are making a decision. And the third main factor is that we are doing it along with the client or the patient, which is very important. Which is not just that, oh, you have this problem, so I'm going to prescribe this and that's it. That's not the way we're looking at evidence-based practice. And this has been this definition was put together in the late 90s, and it's very interesting because this is very specific with music therapy. And the components, like I said, what are the components of evidence-based practice? There are three major areas. One is research evidence. So we work with clinical experience. We also base our practice on what has already been done. For example, if anyone is doing something in the medical field, if they're doing a procedure or they're doing a research, there must be some evidence from the past that this has been done. We can also do something new, but that cannot be in real time. It will only have to be as an intervention to try and see. That's why we have these researches where we have to do trials before it comes into real practice. So we need to have research evidence before you put it into clinical practice. The next practice. When you have clinical practice, it targets the process of going through the whole process of working and finding a meaningful way of taking the treatment forward. So it talks about the processes and the outcomes, which is valuable. And this is not only for the benefit of the patient, but also to make sure that we are doing the practice in the right way. So it is also from the disciplinary side and the patient side. So we are actually looking at all kinds of levels in participation and collaboration with the patient, that is the client. So it's not based on just what you have found out. It is also based on what the client needs. So it is a process of connecting all of these three: research evidence, our practice, and then we bring it into the work that we are doing. All right, so now how are we bringing this into music therapy practice? So now actually music therapy has been defined by Brascia. This is the late 90s. He's one of the major music therapists who have definitely defined music therapy and has evolved from the 1950s. The 1998, he actually came up with a very simple definition saying that the client and the therapist work together through the medium of music to bring in health promotion. So the idea is that just because I have music does not make me a therapist. And just because there's a client with a problem, it does not make him get better. But it is me as a therapist who is bringing in the intervention along with the client's needs and thoughts. And that, with the use of music, we look forward to taking it and making it better. So that's what we talk about evidence-based practice in music therapy as well. So just like I said, the three things: research, then practice, and then we bring it into the intervention. All right, so that is basically what I've already explained. This is the definition given by him. But this, if you see with music therapy, there's a lot of subjectivity that we have to work with. So we also have very diverse ways of working and the ability to apply what we have got to work with each patient. So when we work with each client, their musical abilities or their needs or their thoughts or their accessibility or acceptability to take the treatment is very different. So I might have the same musical repertoire with me or the list of songs thinking that this will work, but it may not actually work when we think it will. So it is based on objectivity and reflexivity, because reflexivity is at that point of time, am I ready to take that therapy or that intervention given to me? So this evidence-based practice is based on a therapist working with a client, based using the musical interventions, based on their diversity and the way to apply it with them. So this is basically what I've been speaking from the beginning. Now, I was very interested with this domains of music therapy evidence, which has been constructed by Abrams in 2010. This is specific to music therapy and any kind of art therapy. because there we talk about objectivity in research. Okay, but when I just spoke about being subjective as far as it comes to creative arts, that is music or drawing or any kind of handiwork that you do is very subjective. Some people will be very creative and some people will be open to doing things. Some people will not be able to do it. Now, when we look at objective and this construct, if you see, it is an integral format of working. You see that on top you have the interior and the exterior, that is from within the body and from outside the body. That is, you have from the individual perspective, what's happening within me will be the interior effect of what's happening to me. But when it comes to how I feel, sorry, that will be the external. Within will be how I feel, how do I connect with myself, how do I connect with the next person. So when you look at the individual, I am working with one person subjectively, meaning that this is working for me, this is how I feel, this is my emotion. So that's how I work. So it is a beautiful art and it is intentional. So when we are bringing in the music intervention, we are trying to bring out the subjectivity of that client or the patient, to say that it's intentionally I'm trying to do something with the patient to bring an outcome. Same thing when you do it as an intersubjective way of doing things. Subjective, like if you see subjective in the individual and the objective in the individual, it means that single person. But when you look at it as an intersubjective or interobjective, it becomes the global, the environment that you're living in, the social aspects, the intercultural aspects, all of that. For example, I'll give you an example for each of this. For objective, for example, when we're working with pain and anxiety, we have a specific area. For example, let's say pain and vital signs like BP or heart rate. At that point of time, we give them a music intervention, music therapy intervention. We're able to take a pre and a post of those, of the effects of that on the BP, on the heart rate, on the respiratory rate, and we also get their pain rating. We're using a numerical scale. So what happens is when you're doing a research on that basis, we have a clear-cut structure which is reliable, and the total sum of that analysis of that particular study, after about, say, let's say we have worked with 50 patients on a control and a intervention group, we would have an analysis and you can generalize it to an extent. That means the structure is very clear, it is reliable, and it can be or may be generalized. Now, when you talk about interobjectivity, so objectivity is very clear. We are objective. Like when you're doing a research, everybody knows you have to have an objective and an aim. So here the objective is very clear. We want to check the differences in the heart rate and the BP. Now, when we're coming to the interobjectivity, it may not be just the physical factors. It could be that, I'll give an example for that. When we are working with a patient with schizophrenia, all right, and we will be doing an intervention, but that intervention could be something that would correct or change the behavior of that person to connect with what he does at home or in his environment. So if I'm doing, let's say, a songwriting activity with him or her, and I find that he has these issues of not being a part of the social environment, the people, I cannot trust people, or someone is hurting me. But when we create this option of being positive, or being able to trust at least one person away from the hospital or the therapist, that means we have made a change in his environment. So we have actually improved the sociability or the trust factor in that person to live a more sociable life. So that is interobjectivity. We still have a specific reason as to how we do it. Now, as we look at subjectivity, like I said in the beginning, it's about our emotions. How do we feel? So this would be mostly qualitative. Qualitative in the sense we can't really number it. It is about how I'm feeling. Okay, after I listen to music, I'm remembering all of these things and it's making me very sad. I want to cry. Or when I'm writing this, I feel a lot of hope. I feel like I can get over my problems. So it is a feedback of the client and it may vary based on each person's background or cultural aspects or issues. Now, intersubjectivity would mean, again, like I said, on a global or a intercultural aspect. For example, take an example of someone with the gender issues. They would have a lot of problems in their society. It is basically with the way they have been born. They don't have, as a human being, they're all the same, but it is about them being taken from the society. So how can I take music therapy, work with this person to be a part of the community, to accept that this is me, but I have to get out and be a part of that community, bring up the hope and the thoughts to be a part of the community. So that is intersubjective. So it is not just me, but me in the context of the next person or even myself. I should be able to cope with who I am before I can take myself out. So that is intersubjectivity. So these are very interesting thoughts because they can also be integral and they're not separate by itself. So if I'm working with someone with subjective activities, does not mean I cannot do objective. So if I'm working with a patient or a client, I need to know their musical background, their interest in that particular background. Only then I can play them something or I can do something for them to feel better or to reduce their BP or to even work with them. So there's this connection. If it's the integral format of having individual work with connecting it to objectivity, it can be subjective, taking the subjective information, putting into objective and getting an outcome. So it is not specific, it can be specific, may not be specific. That is why in music therapy, I felt that this was very important for us to know before we can go into understanding the research background. All right, so now I'm going into the research of the last 20 years. It's a compiled research article done by Lee K. Weng L. and Wang X in 2021. Apparently, this is completely core music therapy. Now, all of us are from different backgrounds. I'm going to be talking about how that works as well. We all think that it's an interdisciplinary. Yes, we are interdisciplinary. But this particular review is completely on music therapists who have been trained, educated, and are practicing as music therapists. So their way of looking, the way they work with the clients, the way they create a protocol itself will be different from a person in the psychology department or a medicine from, let's say, general medicine or from psychiatry would look at it, because for them, it is numbers. But for us, it would be more than just numbers to make a change. So if you can see, from the 20 to 25, there were only 30 articles in all of those number of years. That means, and these were published in the first 10 ranked high impact factor journals, which I will show you later. So there were just 30 articles. That means it's actually, we need to have a credentialed music therapist to be able to do the research and to not call it music therapy just because we're using music. So that is why we had 30. But we can see in 2006 to 2000, it slowly increased. And we can see in the last 5 to 6 years, it has come to 115. But that's still not a large number if you see as a part of research, evidence, or trends. It is very less, but still they're very robust. And that is why if you see the journals that have taken it are quite high impact factor, are globally well known. So though the authors have been writing books, have created theories, have created a platform for the next generation to bring in their work. So like I said, this is how the trends in the research evidence has happened. What are the countries? Now we all know in India, we still don't have credentialed music therapists. It's very specific to the Southeast Asian region. It's very similar to South African regions. There are many other Asian regions and other areas around the globe that have still do not have core music therapists yet. So if you can see, this particular thing is an impact on these certain areas of the globe that have worked. You see, the USA is the highest number of journals. Then if you see those lines that goes in between these countries, and you have Germany, 1 second. Okay. Denmark, you have the big ones, Germany, England, Norway, Australia. You see, they are the bigger ones, because if you see in Europe and in the USA, they are the major number of music therapy programs that are actually there. South Korea, they have a little bit. They have now music therapy associations, which are actively working. But majorly, it is the UK and the US. Now, if you see the collaborative studies are also those lines that you see, they connect. You see from the US to People's Republic of China, then you have Norway to USA, and then you have Australia to Turkey, and you have these other areas. These lines actually show the collaborative work that they do with inter-country or inter-research kind of ways. So if you see the countries here, USA, Germany, England, Australia, Norway, and then the last 5 have the lesser number of research, but still impactful. So this is the range of countries in the world that actually have core music therapy studies. Now, like I said, I'm from that study, the major areas that have been researched in music therapy. If you need to, I would be happy if people would actually pick up those things that are there in these, because they're very clearly music therapy language. You can say improvisational music therapy with autism spectrum disorder, in rehabilitation of addiction, clients with cancer, as well as psychiatric facilities. So they're using not just listening. You're using improvisational music therapy. That means you should have a well-established musical background with an understanding of how to use improvisational music with that particular population. So what is improvisational music therapy is to be able to spontaneously create a session with instruments or music, melody, and then get them to connect with you. So that is a give and take, a sharing of sorts, where you have to understand why you're even doing that particular technique. Next is quality of life. Here it highlights efficacy of music therapy with clinical skills to improve psychological disorders, chronic illnesses, and pain management. And then the other publications highlight areas of keywords of health, efficacy in the elderly, and so on. So if you see, the major area in these music therapy studies are very specific to music therapy. Therapists who are credentialed, who have worked, who are trained. Then it goes down to clinical skills. So majorly they may be from the interdisciplinary settings where they work with rehabilitation, where they work in hospitals and different areas, in psychiatric facilities. Pain management and chronic illnesses majorly would be in hospitals. Psychological disorders, they do have a lot of rehabilitation centers and other addiction centers where music therapists are placed. And other publications, if you see, the third one is very generally said. They use keywords of health, efficacy, and in elderly. So, but they do have other areas as well. Okay, now I'm coming down specifically to these. There are about 46 areas that has been that I found from another paper that was reviewed in 2019. And in that paper, they have specifically found out 46 specific areas. If you see, the first few of them are all autism spectrum disorder, developmental disability, depressive disorders, emotional disturbances, behavioral disorders. So if you see, they're all mental health issues plus disabilities with children with special needs. Then we slowly come down to speech and language, trauma, neurological disorders. Then you come down to psychiatric issues, palliative care, TBI. So it goes down from the major area of work that music therapists do down to medical. And then you come down to orthopedic impairment on the 41st, burn injuries. They all come towards the end. But if you see, music therapy works over a long period of time with those specifically mental health issues or with children with special needs. Now, I would really like it that there is a connection to what I'm showing you in this slide to another slide that will come 2-3 slides later. Can you see the different kinds of techniques that have been used and the percentage of uses? It's singing and vocalization, instrumental playing, which are all 90% and above, improvisational music therapy, movement and dance, which are about 74%. Movement and dance is also around 50%. But listening to pre-recorded music, listening to live music comes to around 40%. Now coming to songwriting and composition comes to 46%, music combined with other media, computer-based with music activities and others. So they go on tapering down where there is less amount of interactivity with the patients. So that is where music therapy is different. The whole idea of me planning to show you about the research is to say how we as music therapists actually work in real practice and how we try to research it. Now I'm coming down to the publications. The top 10 ranked publications where the most highly impact factor publications have been done are Journal of Music Therapy. They are specific music therapy studies. Nordic Journal of Music Therapy is very, very robust and does not take anything that's below the level that they expect. Arts in psychotherapy. Psychotherapy and psychoanalysis is a very major area of work with music therapists. One of the psychological theories that we all have to learn to understand how to work with human beings and when they have very severe mental health illnesses. Analysis of the New York Academy of Sciences. If you see, the impact factors and all are quite high, may not be like the medical sciences or other areas, but for us, for the music therapy journals, these are quite high impact factors. Complementary therapies, Journal of Clinical Nursing, if you see, that's also another area. There are a lot of studies done by nursing colleges and students. Journal of Palliative Care, Cochrane Database of Systemic Reviews actually has a lot of music therapy study reviews. There is one on schizophrenia, one on pain management, and a few others that are there. Frontiers in Human Neuroscience, because a lot of neurological music therapy studies are actually published in these kind of studies. There's a whole subject called neurological music therapy, which has many techniques within it to work with people with stroke or TBI for rehabilitation, even with children with special needs for speech and language, motor rehabilitation. So that is a very huge area of music therapy. And then psychology of music, which is also what we need to understand. It's not just the psychology of human beings, but how music works on them. So these are different journals that are very high impact factor for publication of music therapy articles. Okay, now I'm going to take a deep breath and I'm going to go into music therapy research in the Indian scenario. There are two categories of people. This is true all over the world, but I want to specifically talk about our country because we need more people to work with music therapy. So to understand that being knowing or having a knowledge about music therapy foundations, understanding the mechanism of music and the therapeutic aspects is very important. But you will see the major amount of people who do it are have a knowledge or are educated in music or psychology or medicine or other areas, and they other related areas, but they can also have a combination. So someone would have studied music but also have a psychological background. Someone would have music and be a doctor. Someone would be a nursing professional but still know a little bit of psychology and a little bit of music. So it's all a mix, but none of them really trained or educated in music therapy. That's a major chunk, almost 99% in India. Then we have trained music therapy students, faculty in music therapy, or full-time music therapists, which is a very, very small percentage in India. So this is a major cultural aspect. Now, this is the slide that talks about who is doing these studies and what they are using to do the studies. So if you see, there are these on the right side corner of the column. It has nursing, nursing and neurology, nursing again, speech and audiology, psychologists, psychiatrists, even human genetics. Then we have Hindustani classical musicians. We have a neuropsychologist who's doing it. We have pediatricians. And if you look at the techniques, all of them except one is music listening. And even that would have nothing to do with a therapeutic aspect, but just asking them what would they want and then playing it to them. Or creating a set of songs and saying that you will listen to this particular raga or this kind of song, and then the other wouldn't. So there isn't really an information about what the clients really need. So I wouldn't say they didn't ever do it, but majorly when you have to work with clients, you need to know their preference so that we do not have a negative impact. For example, a song may be very difficult for a person to listen to. And if you by mistake give a raga or a phrase of music or a particular song that may bring back uncomfortable feelings, that may not be good for the study, nor would it be good for the patient. So till now, we wouldn't have heard of the negative impacts of music. But if we do not really understand what is the need of the client, it may cause issues where they may feel even more drawn into their depressive states. They may start feeling uncomfortable feelings which we may not know how to handle. So we need to make sure that we really know. For example, when we do a study, or my first study when I did it, I had about 100 songs for which I actually spoke to about 50 to 60 women in the pregnancy ward, in the antenatal ward, and picked up the major songs that they all liked or gave me as a interest level. I used that whole repertoire created into different genres of cinema music, and which consisted of motivational, happy songs, sad songs. Then I had devotional. So I had different genres of music, which I would show it to them and say, do you want to listen to any of these songs? And I would let them choose and then let them listen to that song. So that would create a more positive impact. That is, I'm giving that importance to the client to do what they would prefer to do. That is where the impact would be more positive. So I wanted to show this as well to show you the difference between how music therapy studies are really done and how we need to slightly change the way we do things here. Okay, so now I'm going to talk about the key needs of what can get better research publications in our country. In research at the School of Music Therapy, we have the three key areas that would create evidence-based practice. For that, first we need education. So with the base that we have and the support we have from Shri Balaji Vidyapeeth, we have an institute now that stands after almost 12, 13 years of giving it the background of working strongly and trying to build up an education system which is still evolving. So we have a postgraduate diploma in music therapy. We have a master's in medical music therapy. We have a PhD program. We offer internships, and we also have observerships that goes on from 1 month to 2 months. So these people who come in for observerships wouldn't be called music therapists, but they would probably intrigued by what we do and probably want to study. Next would be clinical practice. So that's a connection, right? Even for whether you're nursing or you're psychologist or your medicine, you all need to do practice. We all need to do practice. So that's where it goes from theory to practice. And for us, we need a minimum of 1 year in medical and community setting. That's the base, because still we do not have the placement, nor do we have the financial stability for us to step in and just take in a job or take up a UG or a PG. We only have a PG till now. So we have an average of at least 1 year of clinical practice, so that you will know how to document, how to work in an interdisciplinary setting. And then the work that you have done would emanate into research. So as of now, in the last 12 years, we have completed 26 research publications that were scientifically done with a proper protocol in connection with different interdisciplinary settings. We have done it with pediatrics and obstetrics and gynecology, in procedural support, and so on, even in the community. We have 7 students who are just completing. So we have 2 PhD studies and about 6 master's theses. We have about 14 review studies that have been done, compilations, conference, and other data that we try and publish. And the more and more we do review articles and research articles, we only get more ideas as to how to implement it in the research aspects. Now, with the School of Music Therapy, we have actually connected different kind of clusters. So when we do research, we try and see where can we fit it. Now, in India, we know that traditional music healing practices are very famous. Not famous, I'm sorry, are prevalent, right? We have a history of a lot of traditional healing systems. When we have Ayurveda, we have Raga Chikitsa, we have Sarang Devas, all of those, time theory of ragas. We have ragas. Ragas are a huge area of work where we have a lot of literature, but no documentation for it. I am sure in those days, they actually did something to actually come up with the idea of these ragas having this particular effect. But in these days, that data is not enough. We need to, like I said, have objectivity where the raga is used, and then you can actually bring in evidence to say, yes, this actually works this way, or no, this can work in a different way. And then we understand the frequencies, we understand how the phrases are used, we understand what kind of emotions are used, because in the Indian context, emotions are very important, and ragas have a lot of connection to emotional expression and thought processes. So if you see, the aim of this particular research cluster is to objectify and create evidence for traditional healing practices, and we try and integrate it into clinical practice. So we had a study where we did with depressive pregnant women, and they used an Indian classical raga as a receptive music technique. This went on for about 3 to 4 months, and then they found it was really, and they saw that it has an improvement in the tridoshic balance. That is the Vata, Kapha, and the doshas. All the 3 doshas that were there, they actually found there was a balance. Then we also did a very simple study where we did a musical Om chanting with the one basic raga. And then we found there was a change in the body temperature. It was a very exploratory study. I think we did this way back when I started the studying for music therapy. And then there is a study where we used chants. Chants are a very major part of our Vedic sciences in India. We use this chants during labor pain, the first part of the labor process. And we found that it really helped them to cope with the pain that they go through. And then we have used ragas on cancer patients. We have used a particular raga that Ahir Bhairav on blood pressure and pre-hypertensive adults. We've also used raga to see the changes in behavioral parameters of preterm infants. So the need to bring in the data to say that our systems actually have that effect. So we try to bunch it together in this cluster. The next cluster is community health and well-being. And the aim of this is to create awareness and serve families and communities with music as a cultural resource and defense for health. In this, you can see there's a geriatric study where we worked with the geriatric population in a convent, and we did a lot of singing with them, and then we scored it. Like, for example, this, you see this, they're all very objective, but we're working on a very, on a group sessions where you can have very subjective information coming in, but their scores actually had a very positive effect, and we found it was very good. We also did something in the intensive care unit where the caretakers are waiting. We all know that they are also a community of people who are not looked at all, but they are the most exhausted. And we found that how they actually are eager for music sessions where they listen to song and they can also sing along with us. And then we did one with young adolescents who have just joined the medical school, and to understand what their needs are. So once you find the needs, then the next step would be to go on to another thing, which I will talk about later. And then we also found another study, relationship of music therapy and the personality traits of neuroticism and agreeableness. This is also with students. So there are different communities. We still have to do a lot more. Then another thing is collaborations and patient outcomes. Now this is all interdisciplinary. So this is to encourage and strengthen the evidence by interdisciplinary collaborations to improve the quality of life and patient outcomes. So this is specific to the medical departments. Now we saw there are some MD students from the pediatric department who actually did a study. One was, both of them were from the neonate and for pediatrics, where they used music. They used live music in one, and then they used one for the infants. They actually used the mother's voice to find out how it has an effect on the infants. And then there was one where we did on blood pressure and in pre-hypertensive women. We have done in endoscopy. In endoscopy, we have more than 2 articles. We have done pre and post. We have done during endoscopy. We have found the cooperation levels, which is very sort of qualitative, that we ask how they feel about it, how have the patient cooperated, and the patient's feedback as to how they felt and the discomfort levels. Then we had done something with yoga as well. So we had one study where we collaborated with the cardiology department, angiography. We combined yoga and the music to find out how it works as a combined effect. Next is the mind-body medicine. Normally, if you see mind-body medicine, any area you take, music starts from the mind. It has an effect on the body, and then you would find the changes that happens either in psychological aspects, physical aspects, or physiological areas. But in this, we wanted to specifically see how to foster high-quality music therapy research on autoregulation, psychoneuroimmunology, and psychoneuroendocrinology. That is, we're going into the biomedical aspects, into inflammatory markers. One of the studies that was done was on perceived stress in eczema. And the next one is the study that I'm doing right now. We are working on hormonal markers of breast milk secretion in primigravida mothers. So the idea is that we started off with just BP, heart rate, and anxiety. Then we move on to doing what is a better way to explain the mechanism of the body. So we all know how when we are very stressed out, cortisol raises. So, and there are also studies that say that when you listen to good music, your cortisol reduces and oxytocin increases. And that is a study where they have done objectively to understand the changes in the hormonal levels. So that's what we are trying to do here. But due to a lot of financial issues and funding that we don't get, it's very difficult to do it. But hopefully in the future, if music therapy becomes more aware, has more awareness, we probably get more funding to do it. Then is education, the professional training cluster. In this, we try to help students and the faculty to learn and to hone their skills, to prepare them to get into research or for higher level teaching, or even to go for higher education. Here we are still doing the studies because we just had a few of us just completed and we're just getting into teaching and academics. So we have these copyrights. Like I said, there was a study before where we found out the preferences of the students, and then we made a program for them where we could actually incorporate music in different ways to understand how it will have an effect on their emotions. So that is a copyright called Musically Expressing Emotions and Thoughts for Students. We do that as a part for all the students within Sri Balaji Vidyapeeth. It first started in 2015 with MBBS. Now we do it for dental students, for nursing students, as well as AHS. And hopefully the next couple of years, we'll start off with physiotherapy and pharmacy, hopefully. And then there is a new project where we are starting. We are trying to find out what is the perception of music therapy with the parents of the students who come and learn from us. So these are the different clusters where we try and put all our research into. Maybe we'll find more clusters when we have more work that we have done. So I want to talk about, before going into the other avenues, what we are actually doing in the future, this coming 1 year. Some of them are very simple, where we have used effects of live music and tactile stimulation on neonatal pain management. One is very specific because it's music during episiotomy repair, that is after delivery, they do a stitch for the women who has just delivered. It's a very, very delicate procedure. And the student who's actually doing the study came up with the idea because she found it had extremely positive effects on them. And in fact, in between, even they even start to sing along with them. So that's, I think, one of the very interesting thing, may not be very high aspects or high level, but it's very simple because we are taking it to the patient and they're able to handle their problem at that point. Other than that, we have studies in alcohol dependence. Then we have on cardiac surgery patients. There is one with adolescent students in a school where we're trying to understand how music therapy can have music therapy has an effect on their life skills in these students. So they're working on the 8th, 9th, and the 11th standard students because it was difficult. Like the 10th and the 12th were not available at the moment. So, anyways, and then we're doing something on cataract surgery as well. So normally we find pre and post, but this time we are actually trying to do it during the procedure as well. So we have another very interesting studies on COPD patients where we are looking. One of the students is actually working with a particular instrument where they work, and then there has a change in the quality of life within a hospital. So these are all the studies that we are doing at the moment. So I'm coming towards the end of the talk, and I'd like to talk about the advantages we have here as a part of being a school in Sri Balaji Vidyapith and under Institute of Salutogenesis and Complementary Medicine. It's because we are part of a healthcare university. Education is a major part that we have. Without education, I don't think we would have come to this point of saying we have this many studies. And then we have the accessibility to work within a hospital. We have the doctors who are very open. We have even gone into the operation theater. We work with patients with disorders of consciousness. So the availability of patient care is extremely positive. We have a research-oriented space because we are in a healthcare university, and with the push for us to do more research and for us to create awareness, we are given the opportunity to do our research side by side with all the other institutes within the university. Then we have inclusivity. Like I said, they have taken us as part of them. They give us the space, and every institute is happy to give us a space to work with them. So there are a couple of studies in dental college. We are doing one with AHS also. We have a couple of electives with nursing and AHS. So being inclusive is very important for us to grow. Then for clinical details, when we go into clinical practice, the doctors and the nurses actually help us to learn on the clinical areas, what is necessary. They even take classes or sessions for our students based on what kind of patients we are working with. And then we have the support of the clinicians and the physicians. In our curriculum, we have Dr. Shiva Prakash, who is also from psychiatry. We have a registrar who's a biochemistry doctor. We have Dr. Ananda sir, who's from yoga. We have Shobna ma'am, one of our in charge of School of Music Therapy, who's from physiology. So we get the wholesome experience of learning not only from music therapists, but around everybody as well. So I think we have very strong advantages, but I'm also going to talk about what we need more. One thing is awareness of the importance of music therapy. Though everybody understands or wants to give us this space, the importance of music therapy education, the need to understand what is music therapy is very important. So the advocacy, creating awareness needs to be done on extreme levels, but we are doing it in our own ways, trying to see how we can create that part. We need funding for projects because we are not a part of the curriculum or a part of the central education system or known by any associations. We don't have credentialing or we do not have funding that's coming in. So if we had that part of it, I think we would get better. But I think with our university and the new educational policy, hopefully in the next 5 years, we should be able to develop that as well. Like I said, recognition of the programs within the education system. Hopefully, like I said, with the new educational policy, music therapy will be an accepted program. Regulatory bodies, though we have associations, even they are from the background of medicine or psychology or music, and understanding how to give a credential for music therapy is still to be done. And then requirement of teaching faculty, which will also, once we have more people qualified and educated from the music therapy field, I think that would also be cleared. So the limitations are there, but hopefully in the period of 5 to 10 years, we should be able to develop and make a better mark. Now to look at how to go forward in the way that we have been working and the research that I have studied, and looking forward, I have found there are very less number of studies when it concerns women's health. When it comes to gynecological problems, menstruation issues, PCOD, even general lifestyle work, being able to handle their own selves, being able to cope with their situations, talking to somebody. I think that itself is very less. And we even wrote a paper on PCOS, and that's when we realized that the how understudied this population is in every which way. And then we can work on biochemical and inflammatory markers. Then we have a lot of MRI, EEG, ECG, HRV. Hopefully, HRV will happen, EEG will happen now that we are having a research area in our own institute now. Hopefully, in the future, we will be doing that. Musculoskeletal functions, mostly we are looking with people with children with cerebral palsy or anyone who's having motor area issues. Um, Rehabilitation and stroke. So there we can look at how music can work, because like I said, there are neurological music therapy techniques that can be used to make a change in these areas. Qualitative studies. Now, like I actually explained in the beginning, we have a lot of information that can come when music is used with patients or clients. And qualitative studies are very difficult because it's a lot to transcribe, a lot to understand, a lot to analyze. Basically, because transcripts, when you take surveys or interviews or do focus groups, um, the whole conversation has to be transcribed, and then we have to bring up themes, and that is a lot of work. And also understanding that it's not really objective, but may bring out a lot of subjective thoughts. That is also very difficult. You need to have 3 to 4 people who would sit together, discuss about it, and come to a conclusion. Video analysis is also one of the major areas of qualitative studies. There are video analysis softwares which are quite expensive, but hopefully we'll be able to do it in a very small way. With music therapy, videos create a lot of impact. Hopefully, in one of the sessions, if there is time, we can show you how we make videos of patient care, which are done completely on consent. We do not do any kind of video or photographs or any kind of data from them without a consent form. So if any of these things we can show you how impactful videos are when we do research or even when we do regular practice. And then now we are looking at community areas, but the future should be to creating programs in schools or colleges in different community areas like geriatrics or in palliative care, in rural areas, in children with special needs, in homes, and many areas that are there. So this is how I look at it. There are many more areas, but I thought I'll just take it as broader areas under which we can constantly be working, apart from all the other 46 areas that has been already given in research previously. Right, so this is my references. Thank you. So any thoughts, any questions? I think there's a question.
Well done, Bhuvana. Very nice presentation. Enjoyed it tremendously.
Thank you, sir.
There are 2 very pertinent questions in the chat box that Professor Shiva Prakash sir has asked. I think taking them up would be a good avenue.
Yes, sir. Just having looked at it. With regard to trends in publications, most of these publications appearing in core music therapy or core clinical journals that focus on clinical conditions and medical therapies. This is relevant because clinicians are more likely to be touched. Yes, so that's exactly why I picked up those articles or journals, because it is done by a review. And if you see, they are core music therapy studies. If you see in the global areas, the work that they do is specific music therapy. In medical areas, it is still coming up. I think majorly in India and some other countries in the group, they do a lot of medical music therapy, and it's still growing there. They have specific areas in NICU. But if you see the articles that I actually showed in the presentation, Most of them, like I said, they are on disabilities or with children with special needs, psychiatric areas and all that, but they are done on a very qualitative area. So I'm not sure if they actually come in clinical. That is why I showed you Frontiers of Neuroscience and Journal of Music Therapy, Nordic Journal, and some of them are nursing journals. There was one on palliative care, but they are major music therapy studies. And I understand the question about clinicians wanting to know. I guess that is why this interdisciplinary studies that we do here, we don't look for music therapy journals, we look for interdisciplinary publications. Like most of the journals that we have picked up to put all of our studies has been in pediatric journals. I think there was one in a nursing journal. There was a few other areas where even one in OG, I think. So when we are working in specific medical areas, I think that would more go into the clinical journals. But when you look at children with special needs and all that, then normally within the clinical areas, it doesn't fit in. And when we do music therapy, they use areas such as GIM, and they're a lot on the qualitative aspects. So I don't know. I think it doesn't really fit into the clinical areas. But there are studies, like I did say, some of those studies that you see, the journals that I showed you, for example. Yeah, so I think that's the Journal of Clinical Nursing, even the Cochrane databases, the Frontiers of Human Science, even Psychology of Music. Some of the interdisciplinary studies come into it, but they are the top ranking in music therapy. But there are other journals like Music and Medicine, Voices, and other music therapy journals which actually take in clinical studies that we do. But this I wanted to clearly say, because if you see the studies that are done in clinical areas, they are mostly not by music therapists. Very rarely you will find them working and doing research in a clinical area. A less percentage, I would say, globally. I hope I have answered that. And if anyone wants to add. Yeah. No, he's saying you're not audible. That is the question. Yes. With regards to trends in music therapy research, India and globally, how much research is happening involving biological parameters, outcomes such as functional neuroimaging biomarkers? Sir, actually, that is a very major area. Like I said, neurological fMRI studies, there have been quite a bit. Mostly, if you see there was one study that came out from Professor York Faulkner, who did a study in 2021, and he found that when they did music therapy, there was this particular points where they actually found there was a connection, and they had a full neurological imaging of the connection in brain brain areas. But biological parameters, when you see, it's quite difficult, because we need this biochemistry background, and for that you need core clinical learning and thoughts. I think that's why you will not find many studies with biological parameters and outcome variables as such. And here, if they're given us a chance to do it, I think from what I have done as a part of my review, there are very, very less studies that goes with lactation based on prolactin. Oxytocin, I think I found 2 or 3 studies, but they were also not very clearly explained as to how they went about doing the music therapy intervention. So biological parameters, inflammatory markers, they say there is an effect. There's a mechanism that they talk about, but there aren't many studies specifically, sir. So I'm hoping that one of our studies that we do from here, and I think this would also work more in a medical university. You see, around the globe, there are very less number of institutes which have their department or a school in a medical university. So I think unless you have the base for biochemistry and immunology, it would be very difficult to do these kind of studies. Another thing is also funding. With music therapy, I don't think there is much funding in many areas of the world. Probably UK and US, but mostly there they work on rehabilitative more than biological or hormonal. So that's what I have seen from my review, and because my study is specifically with biomarkers. So that's what I have understood from research in the last 10 to 20 years. I hope that answers your question. Yes, I'll stop sharing. So thank you very much, Janita, and thank you, sir, for your questions. Very interesting for those questions. I always look forward to that. Thank you, Ananda, sir, for your feedback as well. I had a great, I learned a lot from this presentation, because when I read it, understanding the paradigms and the shifts and how evidence-based music is actually done, I personally learned a lot, and I got a lot of answers to what I've already done, but trying to connect the points was really interesting for me. So I'm happy about the topic as well. So I hope there was some amount of learning and understanding of the presentation. So thank you very much. And I think our next session will be on Wednesday next week, where we'll have Professor Gehard to check, and Stephens, who will be talking on 2 different topics of music and medicine. And Stephen will be talking on how music can be used in rural areas, in remote areas of the country. So thank you very much for all being here today.